When I was 9 years old, I lost my mother to breast cancer. She was only 36. She was diagnosed late, and it was partly because she had a lot of fear about the symptoms that she was experiencing, and she didn't share them with anyone. By the time she shared them with her husband, my father, they went immediately to seek medical care, but the gynecologist that they went to see passed it off. She's such a young woman, this is likely to be nothing at all. The lump grew larger, and in the end, it turned out that she had metastatic cancer, and she lived only 2 years. So this was an inspiration to me because what I discovered as I grew up and became a public health researcher and went to learn more about breast cancer in India, what I learned was that even today, women in India are getting diagnosed with very advanced stage breast cancer. They're getting diagnosed at stage 3, stage 4, very advanced, and at that point, treatment can do very little. There's only pain and palliative care a lot of the time. And women are dying, continuing to die young. What we're seeing in India now is that maternal mortality has declined, but women are just living a little bit longer and then dying of breast cancer and cervical cancer. So this has inspired me to take on this issue. So we have a growing epidemic of cancer in India, particularly among women. As I said, India has successfully reduced maternal mortality, and what we're finding is that women are living just a little bit longer and dying of breast and cervical cancer instead. 25% of the global burden of cervical cancer is in India. That means that 1 in 4 women dying of cervical cancer lives in India. In addition, 13% of the global cancer burden is in India, and 7% of the global burden of breast cancer is also in India. Now in India, about 50% of women do not survive the first 5 years after being diagnosed with breast cancer. And this is in stark contrast to the fact that 90% of women diagnosed with breast cancer in the United States are surviving with breast cancer after 5 years. So the scenario in India is that women and men, and in India, one of the top cancers among men is oral and lung cancers. So women and men in India are getting diagnosed late, and they're spending a lot of money on cancer treatment for very poor outcomes. This is in part because of lack of awareness of cancer, the different ways in which cancer can be prevented, the need for early detection. There is fear and stigma related to cancer as well. So women, for example, who are experiencing symptoms of cervical cancer, which includes vaginal discharge, lower abdominal pain, these are symptoms that women typically do not reveal to anyone. In fact, there's shame and embarrassment associated with them. There's a culture of silence around women's gynecological health. So fear and stigma is also leading to delayed diagnosis and poor outcomes. Thirdly, we have a healthcare system that isn't configured to deliver prevention, early detection, and screening services, particularly close to where people live, that is at the village level. So our primary healthcare system has been oriented towards addressing maternal health, child health, but has not been configured to deliver cancer prevention services. And the linkages between primary healthcare, which is where lots of people go when they initially have symptoms, the linkages between the primary healthcare and secondary and tertiary levels of care are very weak. So you have people who seek healthcare, but then they don't progress fast enough through the healthcare system to actually get a diagnosis and then to quickly get into treatment. And in fact, the final challenge is the fact that 80% of expenditures on health are out of pocket. So when people are faced with a cancer diagnosis, they are completely depressed and dejected because many of those individuals cannot afford cancer treatment. So we are looking at 2 ways in which we can catalyze cancer prevention in India. First is through strategic communication for cancer prevention, and the second is by improving the linkages between screening, early detection, and treatment. So we're looking for innovations in public health, technological innovations that can help catalyze these 2 strategic approaches. So Research Triangle Institute, RTI International, is a non-profit research institution that is dedicated to improving the human condition by turning knowledge into practice. We have conducted research, worked with many different stakeholders in the United States and other parts of the world to advance cancer prevention. And so we are very well positioned to take all this knowledge here in India and translate it into cancer prevention programs and policies on the ground. We have done several things already in terms of research and technical assistance for promoting cancer prevention here in India. We have completed a study where we've explored multiple stakeholders' perspectives on cervical cancer screening. We've interviewed husbands of screening eligible women because we've realized, based on the work that I've been doing actually on gender and gender inequalities in India, that husbands are a very important stakeholder in promoting and advancing cancer prevention. So we've conducted a study to explore husbands' perspectives on cancer prevention, healthcare workers' perspectives, women's own perspectives, and community leaders' perspectives. And we have brought all these results together, and we have leveraged these results to provide some technical advice and guidance to the state government of Karnataka as they develop and implement a pilot cervical cancer prevention program as part of a larger non-communicable disease prevention and treatment program. That is one result in the cancer field. RTI India is focused on addressing a range of what we are calling enduring and emerging challenges, development challenges in India. So one of the emerging challenges that we are addressing is cancer prevention, as well as prevention of other non-communicable diseases. One area, in fact, that we have been hearing a lot about, including this morning, is the issue of air quality, the poor air quality in India, and the fact that people who don't smoke, because they're breathing this air, are at extraordinarily high risks of lung cancer because of poor air quality. So this is an area that in fact we've developed devices that can help measure exposures to air pollutants, and that can be used to conduct research and generate evidence on the impacts of air quality on cancer risk as well as other kinds of adverse health outcomes. So that's an area of research which is focused on emerging challenges. We are also focused on addressing several enduring challenges. One of the enduring challenges that we've been working on is the challenge of sanitation and expanding access to sanitation across India. Sanitation solutions that meet the needs of women and men, as well as children and young people, addressing and promoting their dignity and safety in the context of sanitation. So we are part of the Reinvent the Toilet Challenge that's funded by the Bill and Melinda Gates Foundation. What we need to do is to continue to generate high quality data on the burden of cancer in India. What are the interventions and strategies that are effective in the Indian context to address cancer? We need to do a far better job of translating the knowledge and the tools that we have into programs and policies. We need to do a far better job of communicating about cancer risk and cancer prevention to the many different populations, subgroups living in India. We need to message to young people, we need to message to older people, to healthcare providers. One of the interesting findings from a study that I'm doing on breast cancer in Bangalore is that when mothers reveal a breast cancer symptom, reveal that they have a lump to an adult child, we find that care seeking is immediate. Young people immediately recognize that this is a symptom that requires immediate medical attention. So we're actually finding that perhaps to advance cancer prevention in India, what we need to do is reach these young adults because they're playing an important role in decision making in their families. We need to do a far better job of creating those linkages between primary healthcare and secondary and tertiary healthcare. So we need to marshal all this evidence that we have, and we need to operationalize that knowledge into programs and policies that are responsive to people's needs. Programs and policies need to be centered around people, around individuals, families, and communities. That is when they're going to be the most effective. There is, of course, a lot that the government can do. The National Rural Health Mission, for example, has really expanded in a very significant fashion access to primary healthcare across the country. Many states in India have really made great strides in reducing maternal and child mortality. What we need the government to do is to now use this platform that's been established and to reorient it so that it can respond to these emerging concerns related to cancer and other non-communicable diseases. And what that's going to entail, for example, is strengthening the linkages between the primary healthcare infrastructure that's been expanded to secondary and tertiary levels of care in order to ensure diagnosis and treatment of cancer. So we need to move away from highly vertical programs to programs that are really about access and about community reach and utilization. So the government needs to invest, we need to increase public expenditure, not only on treatment services, but also on prevention services. The money should go not only to establishing tertiary care centers for treatment, they need to go into bolstering that primary healthcare infrastructure to deliver screening and early diagnosis of cancers. But the government cannot do it alone. We cannot sit back and say, this is what the government needs to do, and let them do it. All of us, individuals and organizations, we need to work with the government.